Hi, I'm Mindy Lane with the Fishers Health Department. I want to first say that it is such a pleasure for Monica and I to be able to serve the city of Fishers with the Fishers Health Department. We often consult with institutions like the CDC as well as the Harvard Global Institute when trying to find the best available evidence to make recommendations for the community. In addition, we consult with physicians and public health officials around the city to get their advice and to help provide guidance on whatever recommendations we provide for the city. Today, it is such a pleasure to be able to introduce Michelle Cesana, a well-respected pediatrician and mom and Fishers resident, so that she can talk to us a little bit more about kids and COVID. So without further delay, I'd like to introduce Michelle Cesana. Thank you.
Hello, my name is Michelle Cesana. I'm the mom of 3 kids. I live here in Fishers. My kids attend Hamilton Southeastern schools, and I'm also a pediatrician. I'm here to talk to you about what we know so far about COVID-19 and kids. And I get it. It is a really challenging time right now for all of us. We're all experiencing a different time in our life than we were this time last year. So let me give you some of the good news about COVID-19 and kids. One of the interesting things is that children under 10 are at a much lower risk of spreading COVID than our kids who are 10 and older. Kids 10 and older spread it at the same rate as adults do, from what we know now. This is interesting because kids younger than 10 generally spread other viruses much more so than adults and older children. So in the case of the viruses like rhinovirus that cause the cold or flu, it's typically the younger kids that spread them. What we also know about kids is that in-person school offers some significant benefits to e-learning, right? Kids who are less than 10 are at a critical time learning math and reading. And not to say that our older kids aren't at critical times in learning, but this is a really important time because it sets them up for success if they are able to learn how to read and how to do math at a young age compared to if they struggle. We also know that in-person learning offers benefits for social and emotional development. It offers physical activity like gym and recess, and it offers also access to mental health services too. However, we have a lot to do to keep our kids safe as they return to school now with COVID. We need to be able to practice good social distancing at school. Kids need to wear masks. They're safe for kids over 2 to wear face coverings. And we need to make sure we wash our hands really, really well when we're at school too, and at home. And I would say importantly, we need to do things as parents and community members to support the schools and be able to return to school. So we need to do those same things, practice good social distancing, wear masks when we're out in public and in groups of people, and we need to practice good hand hygiene. We also need to get our flu vaccine in September once it's available, because we don't want to also have people experiencing influenza too. The other thing I would say we need to do and make sure that we do is be good about not going to work or going to school when we're sick. Previously, people went to work with colds or sent their kids to school when they had the sniffles. We can't do that now. We need to make sure that we follow the guidance of our health department and our physicians, and keeping our kids and ourselves home if we're sick. So I would say the other thing is, it is an individual decision for you to make to send your child to school. Your child may have health conditions that put them at a higher risk of getting COVID, or there may be people that live in your home, like grandma who may be over 65, or other people who may have health conditions like they've got cancer and they're receiving chemotherapy. So it may not be safe for your child to attend school in person for the risk of themselves or others in the home. So I would say, importantly, please, we need to support each other as fellow Fishers citizens and make sure that the decision you make is the decision you make, and that's okay. If you decide to send your child to school and your neighbor doesn't decide to send their child to school, that's okay too. You are the best person to make that decision for your family. So please remember, practice good social distancing, wear your mask, wash your hands, get your flu shot. Thanks to all of you for listening. I appreciate you, and let's keep ourselves and our fellow community members safe and healthy and prevent the spread of COVID.